Welcome to Channel 17, the Town of Colonie Government Channel.
Hi, welcome to the Senior Resources Show. I'm Christine Cary, Director of the Town of Colonie Senior Resources Department. Thank you for joining me today. My guest today is Meg Wallingford, Executive Director of Senior Whole Health. Welcome.
Thank you very much for having me, Christine.
Well, thanks for coming. I know that we've worked together, our departments, our organizations collectively, in trying to help seniors who are navigating the different Medicare and health insurance options that are out there. And you have a very unique program in Senior Whole Health. And I'm pleased that you were able to come on today and give our viewers some information and some education on your program. So let's start a little bit talking about Senior Whole Health and what exactly is Senior Whole Health?
Thank you. Senior Whole Health is actually a new model of health plans. Senior Whole Health is called a Special Needs Plan, and we are a managed care organization, an HMO, licensed in New York State. We're also licensed by the federal government as a Medicare Advantage plan. Many seniors hear about that these days, that they're licensed entities. What makes us a little bit special is our designation as a Special Needs Plan. And that means we've taken the time and the efforts to really identify the particular population that we want to serve. And it's called special needs for a reason. Our membership under the Special Needs Program is primarily for those seniors and those disabled persons that are on both Medicare and Medicaid. And typically in the community, they're called dually eligible persons. What our program does is focuses on just those specific needs. While we would certainly like to serve others, our expertise is in working with the poor and the frail and the elderly, typically living in inner cities, typically living in rural communities, and those that are living in other affluent communities, but in older neighborhoods, or those seniors that are living on their own.
Well, before we go any further, I think for our viewers it's good to tell the difference between what Medicare is and Medicaid is, because many folks just say to me, well, I'm on Medicaid. No, you're not on Medicaid. When I look at it more carefully, you're on Medicare. So could you just speak to those differences?
It is. It's very confusing.
It is confusing.
Is that typically seniors who are 65 and above are eligible for a federal program called Medicare. And that kicks in on your 65th birthday, and it provides basically your health insurance and your medical coverage for you should you become ill. Medicare comes in really two different parts. It's Part A, which is all your hospital services, so that if you're in a hospital, provides your room and board, provides all the services, the laboratory services, the food, your nursing care, all your exams that are done in the hospital. And then Medicare also has another piece called Part B. Those are the physician services and really the extra or what they call ancillary services that you may receive. Physical therapy, occupational therapy, perhaps home care. Those are considered Part B services. So Medicare does provide a comprehensive program. Medicare also now has a program called the Part D programs, and probably many seniors have heard about that.
We've done shows on it.
Over the last couple of years, is Medicare now offers a pharmaceutical coverage program. So Senior Whole Health is both a Part A, a Part B, and a Part D carrier. The difference with Medicaid is a state-run health insurance plan. Typically, it's for those that are elderly, frail, and those that are at a financial disadvantage. Typically, the average income of someone on Medicaid is about $784 a month. Now, Medicaid is provided by the Department of Social Services in each of the counties here in New York State. They have actually Medicaid representatives that would help people qualify for that. So I would say if you have seniors that think they are on a fixed income or that their income is lower than $784, they may want to contact either yourself or contact the Department of Social Services in their particular county.
Correct. And we do a lot of Medicare counseling and Medicaid counseling through the town. We are health insurance counselors through New York State. And we do provide a Medicaid worker at our office once a month so that folks don't have to go down into the city of Albany to apply. So it definitely makes it more accessible for folks. So now that we kind of know what the Medicaid and the Medicare difference is, and if you're, as you said, if you're covered by both plans, you're considered dual eligible.
Right. As a dual eligible person, what we're able to do for you is, because they're two distinct health insurance programs, one's run by the federal government, one's run by the state, as you would have in any other organization, a lot of times they don't talk to one another. And I think the nicest attribute of Senior Whole Health is that we actually connect the dots, so that we connect the services that are offered by Medicare and the services that are offered by Medicaid. Because many times seniors, and in particular their caregivers and families, become so confused what benefits you can have under one, what you can't have under another. How do you access providers in the community that have that offer Medicare and Medicaid services? Senior Whole Health actually pulls that together, and by care management and advocacy, working with organizations like yourself, we're able to pull the communications together. We're able to actually synthesize the benefits, and so that it, for an elderly person or another frail or disabled person, it actually is more of a seamless approach, that you don't feel that you don't know where your next step is. We actually walk you through the health system.
And not only the health system, but the social service system, and how to access other services that a senior may need.
And that's pretty important for Senior Whole Health. We were founded really with the philosophy, and we called it Senior Whole Health, is that we're looking at the whole person. We're looking at their medical needs, we're looking at their psychosocial needs, and those are the needs of, do people have support in their own community? Do people have someone that are preparing, or are they able to feed themselves? Do they have the nutrition that they can go to the grocery store and select, healthy choices? Do they actually need some support of counselors or other guides to help them through difficult periods in their time?
Right. If you have a doctor's appointment and don't have transportation to get there, the doctor's appointment doesn't do you a lot of good.
Exactly, and that's a really neat opportunity that Senior Whole Health has, is because we feel that transportation is really probably one of the key services we provide to seniors, in that it alleviates the seniors not missing many of their appointments. The physicians like it because we're getting these members to their offices, and that so when someone is sick, we can identify their illness, we can actually get them to the doctor, and we can actually help follow up on their care in a much more timely fashion.
Well, that's such a critical component. I hear so often from seniors and from caregivers that knowing where to start and how to provide that follow-through that's necessary is what really breaks down a senior's ability to get the help that they need, and really to sustain at a certain level. They may start off going to the doctors and getting some of the things that they may need, and then things seem to fall apart. So through your program and having a holistic approach to somebody's health, it really helps to address that. Can you talk to me a little bit about the case management component of your service?
We have some wonderful caregiving providers in our organization, and I have a team of nurses that, as members come onto our program, you sign up as you would any other health plan. As you come on, you're assigned a nurse manager, and that nurse manager is really your advocate, or one of your advocates, throughout your whole stay with Senior Whole Health. That nurse manager will visit you within the first 30 days of you signing on as a member of our program, and actually together with you and your caregivers and your physicians, we actually try to develop kind of a roadmap or a care plan to say, what are your needs, what aren't you getting, and how can we get you those certain services? And then by using the roadmap and using the care plan, we work with your physician to identify how frequently that you need certain services, or what types of services you need. And actually we start to advocate for you with community service providers, with other medical providers, and actually try to coordinate those services so that we can line them up and can monitor you're getting the services that you need.
It's such a unique way to deliver services that we haven't seen in this area. Can you tell me what the response has been from seniors that you've enrolled in, from the medical community? It's
been very positive. I think, again, going back to the philosophy, is we wanted this to be a very high touch, very personal contact. And healthcare and really health information is so personal, in that we have so many of our seniors with such history behind them, and a lot of times some of the history is painful to discuss, or you don't want to talk about your disease states. And I think by us making the attempt and having the personal touch, it allows that collaboration with the member, with the physician. I think what we're seeing is the response in the community is phenomenal. Is that we're grassroots, in that We don't go out and market to members in a diner, or we don't go out and hold large meetings. All of our communication with prospective members or members is really done one-on-one. And that's how we started to develop the plan. We started individually at senior housing. We looked at assisted living. We've been working with HUD housing and other housing developments. We actually started with individual members. And as that caught on, their physicians started to notice, wow, something's new, something's different. A funny story I have to tell you is we had a physician in Albany County that had a member that he saw probably once a week. And part of it was a medical visit. Part of it was also a social visit, that this woman had not had any caregivers at home. She had no family, and that she really needed to touch base with a human on a weekly basis. So she became a senior whole health member early on, and was a delightful woman, just wanted a kind touch. So we would call her every other day, check in with her. And we got a call from the physician's office one day, and he wanted to know when Mrs. So-and-so passed away. And we said, well, gee, she really hasn't passed away. We've been caring for her, for a while now. He says, well, I don't hear from her anymore. And we said, well, doctor, one of the things we're trying to help you with is that you were hoping that she would get the care and attention that you couldn't always provide her. Mm-hmm. And by Senior Whole Health fulfilling that need, when she comes to you, it's a much more valuable visit because it's a medical visit, and she can tell you the positive attributes that Senior Whole Health has helped her achieve in her life. Mm-hmm. I like to pass around that story because
great story.
It's become a health plan that is by word of mouth, mm-hmm. not only by the members, but the physicians now see the value in it, is that they see how we can help them and their offices.
Absolutely, and that was my next question. Do physicians see the value in it? And certainly that story illustrates that they do. I know as a provider of community-based services for residents in the town, seniors and their caregivers, there's over 17,000 seniors in the town, so we have a big population here. We have 2 caseworkers in our department, so we're spread pretty thin as a rule, but being able to partner with Senior Whole Health with some of our more frail and financially at-risk seniors in the town, we're able to coordinate what we do so that the work is kind of spread between what a person may need between Senior Whole Health and what our caseworkers are able to do. So it ends up being a nice partnership for everybody involved. And I think for many of the people that we have referred to your program do tend to be more isolated, more homebound, and really do need a little bit more follow-up than maybe we could provide or you could provide on your own. Right. So together it's a nice partnership.
It is, and I think healthcare in general, we'd like to see, as a collaborative, I think, and as a nation, we need to start to be more collaborative, is that not so much siloed in terms of you do this, I do that, but as we're sharing information, we can actually share resources as we do frequently. One of the other components of the program you had mentioned a minute ago is, those that are more isolated. We have in our organization a group of very special men and women called Community Resource Coordinators. And these are really the nurses' helpers in our office because, as you say, some members take a little bit more effort or need a little bit more than others. And our Community Resource Coordinators are social workers and other social service professionals that can actually help do the day-to-day outreach into the community, can make some of these visits just to make sure things are all right in a person's home. And it's, again, another distinguishing feature of Senior Whole Health is that many other plans don't have these type of representatives. We just feel that they're so important, and the best way for us to see you is in your environment.
Absolutely. Yes, I always say when I see somebody in my office that comes in and is looking for some assistance with something, I get a much different picture of what the full situation is and how I can truly help make a difference in the quality of somebody's life, whether I'm seeing them in my office or seeing them in their own environment where they are most comfortable, and you can look and try to address some of the other issues that they may have. We're in difficult economic times, as you well know, and I know that because you're a Medicaid and a Medicare program, it must be challenging for an agency like yours at this time. And I'm just wondering what your plans are to expand in this area. And you're in this county, and we're grateful for that. But to be able to expand and grow the program, so that as folks are watching this, they know that it's a resource possibly for them.
Well, it is. That's a great question because we are very excited about what we do, and we have had such positive feedback not only on behalf of members and providers, but we're also starting to be seen as an organization that perhaps can help solve some of the healthcare issues. We work very closely with the Department of Health, who regulates us, and they have encouraged us, and we are going to be expanding our service area over the next year. At present, when Senior Whole Health started in 2007, we were enrolled and licensed in 7 counties, and that would be Albany County, Schenectady County, Rensselaer County, Saratoga County, Ulster County, and Dutchess County. In 2012, we'll be actually adding 6 new counties to our service area. We'll be up in Warren and Washington to the north. We'll be coming down to Montgomery County, Columbia and Greene counties, and then we're going to add Orange County down to our south. And so it really gives us a much broader provider network. It allows us access to other frail seniors, particularly in much more rural areas. But more importantly, it's allowing us to, as a caregiving entity, show the nation that this is a new model of care and that something new and something different has value.
And it's really cost effective, because as we try to address some of the underlying issues that a senior may have or a family may have in trying to provide care for a loved one, we're really going to save Medicare and Medicaid dollars, because we're going to prevent unnecessary hospitalizations or ambulances being called, or people falling. If we can get the types of ancillary services that a person needs, is certainly going to save us money, which brings me to my next question. What are some of the ancillary types of programs and services that through Senior Whole Health a senior can receive? We talked a little bit about the transportation and the case management, but some of the other benefits.
We offer Meals on Wheels programs. We offer actually dental and vision services. I think people undervalue dental and vision care, and it's so important to them medically, but also socially, is that dental, just in how it plays into nutrition. If your teeth are bothering you, or if you have sores, that's going to cut down on your ability to actually eat nutritious foods and want to eat those foods. Right. So dental is very important to us. Vision care is also very important. Vision, it's shown that better vision or enhancing of vision can help some members reduce their level of falls, because they're able to stabilize themselves and monitor visually where they're going.
It's a shame that dental and vision become a luxury for seniors, and it shouldn't be that way. It shouldn't be for anybody.
Other programs we feel very strongly about are, again, going back to the holistic approach, is we offer in our program podiatric care. We feel that podiatric care is, again, a good component of good health. And again, so many seniors have difficulty with their feet. By actually assisting them, getting them to the podiatrist, we've actually been able to stave off ulcers, sores. We've actually been able to help our diabetic patients maintain themselves more at home and more in a clinically sufficient manner than if they are not receiving podiatric care. And then one of our newer benefits, which is interesting, is a chiropractic benefit. Is that we have a number of seniors that really need assistance in alignment and require manual manipulation of their spines, that it will alleviate a lot of pressure sores, it alleviates a lot of pressure on their backs. We will encourage our members that require that type of care to participate in our chiropractic benefit, and we will make sure that they are seen by chiropractors and treated accordingly. That, in addition to other services like personal emergency response system. For some of our frailer members that don't have caregivers, we want to make sure that they have those services in. Those are like a lifeline or an emergency response button. We really encourage many of our members, even though they don't like it sometimes, we ask them to actually just have this as a safeguard.
Yeah, I often say to folks who say to me, well, I don't need a lifeline or a PERS system. I carry my cell phone with me, or my phone with me when I go downstairs to do the laundry. Well, I hate to say it, but if you fall down the stairs, that phone's probably going to go across the room.
Exactly.
And it would be nice to have something around your neck that you could press the button, because we all know the stories of people lying on the floor for a day or two before emergency assistance gets to them.
Exactly, and we really try to encourage that. I think other services we provide are, obviously part of a Medicare benefit, but we can extend certain benefit requirements based on the individual need. Those are things such as home care, personal care attendant services, homemaking services. Again, we're also looking at, are there needs for congregate meals, adult day health. and daycare. For some seniors that may need to be socialized, it doesn't have to be a punitive opportunity as a benefit, but you could provide socialization and actually just something to look forward to in a
it's
given
so
week.
important. You know, when we look at the whole depression and isolation issues that we see around the elderly, I see it right here in the town of Colonie. The more that we can encourage folks to get out and be part of the community and continue to contribute to community life, the longer and healthier they're going to live, the happier
And you've got
they're
some
gonna
wonderful
live.
programs here in Colonie.
We're very lucky to have a very active senior center and 7 senior citizen clubs, and the services that are provided through the town are really terrific. Now let's talk a little bit about how we know that this is funded through Medicare and Medicaid, but for the senior, what are they looking at as far as cost for this program?
Well, the senior, this is a voluntary program that is offered obviously through the Department of Health. There is no cost to the member to join our program. The one cost that is mandated, and if you call it a cost, is under the Part D benefit. Those are the pharmaceuticals. Typically there are copays of $0 to $3.60, and that really is a federal guideline depending upon your level of need and your financial status, is that you will find that in any managed care or Part D plan. But other than physician office visits, hospitalizations, transportation, there's no expense to any of our members.
That's great, and I just wanted to make that clear for folks that because it is a dual eligible program, that there is no charge. But we'll talk a little bit about the Medicare D, because that is very confusing for folks and the prescription drugs. And you know, as we have more changes in the way the Medicare program and the drug program are administered, sometimes seniors have a hard time navigating, or they'll get to the pharmacy and a drug isn't covered. Tell me the role that you play in advocating for someone who maybe is having trouble accessing medications or anything else.
Well, that's very important, and I agree. Part D, is evolving over time. It's only about 3 or 4 years old now. Senior Whole Health chose to be a Part D carrier because, again, having that integrated component of the pharmacy with the medical, with the social, we just felt it made good sense. We actually have an in-house pharmacist and several technicians that actually support our members, because pharmacy is a tough issue, and many people hear about formularies and covered drugs and non-covered drugs and generic or brand name drugs. One of the philosophies that we have, again, is we're not looking to upset the apple cart. When a member enrolls with us, we don't ask them to change everything to fit in our Senior Whole Health box. We actually have a program called a grandfather program that many members that come to us, if they are on particular drugs that are not on our formulary, we actually grandfather them in for a period of a year. And at that point, our pharmacist speaks to their particular physician and says, does this member require this? Is this medically indicated? If it is, the member will continue to be on that drug for as long as they need it. Sometimes the physicians will say, well, no, I just put her on this because this is what I knew at the time, or this is what we thought at the time. We may make recommendations, but ultimately it's the physician's decision. We don't make medical decisions, and we will support that. A key point that you brought up was at the pharmacy window. A lot of times, and I always feel very badly when I go to pick up my prescription drugs, is that a lot of times there are always seniors there that are questioning the pharmacist. I don't understand what my copay is, I don't understand how I got this drug or why I'm getting it in this dose. We actually have a pharmacist on staff 24 hours a day that can be reached, that actually will advocate for the member, not only talking to the member either in their home or at the pharmacy, but we'll also talk to the pharmacist so that we can make sure the communication between the member and the pharmacist is really what we entitled or what we really want the member to hear and to have the outcome that they need. Many times we will actually call and tell the pharmacist, you know what, why don't you call the physician back? Why don't you actually re-question this, or perhaps ask the physician if he wants something different, and that we will make that accommodation in the systems. We're not looking to, again, penalize anyone. It has to be personalized, and it has to be the right fit for the member.
Absolutely. And it just listening to you talk, and I'm always taken by you and your staff and how excited you are, and obviously it's so apparent how much you really enjoy what you're doing, because you are making a difference in the quality of lives for folks. And I'm just wondering, when we talk about when we treat somebody holistically, I'm sure you are starting to see improved outcomes for people. They're living better, they're living longer, they're going to the doctors less. That's going to certainly impact the amount of medications that they're on, and how many times they have to go to the doctor. So there is a cost savings there. So could you talk a little bit about the wellness benefit, the good stories that you're seeing?
It's and it's not always just about the cost. It's about how the member feels, and that's ultimately what it comes down to. Is that in addition to our care management and all our other programs that are targeted at wellness, we also have a program, our Fitness for Health program that we offer our seniors, that is a $40 gym membership that they would like to see, because we find a lot of the seniors are really very young at heart and want to go do something active. With those benefits, the chiropractic benefit, the podiatry benefit, and all the other services we provide, I think the members take really a second look at what the opportunities they have to change their life. And by doing that, we're finding they're happier, they're actually more socialized. We're actually finding just falls. Our risk of falls have started to reduce because we've actually put good tools in someone's home that will alleviate a scatter rug or a cord. When the nurse is in there and looking at those things, we point those out and try to fix those early on so that we don't have to have the accident or the illness before it happens. And I think ultimately it comes down to the person and their family see a change.
Absolutely.
They may not be great. I mean, some people will have minor changes, but that one positive affect in that life makes such a difference.
Absolutely, and you bring up a really good point, because so many times I'll be talking to someone or out in somebody's home, and I'll see that there are so many little things that can be done in the home to keep a person from falling. We talk about grab bars in the bathroom. If somebody needs grab bars put in their bathroom or some durable medical equipment, do you have the ability to provide that and also install it for a person?
We do. What we do is we contract with a number of home medical suppliers, and actually depending upon what the person's need is, again, we would actually come in and make those adaptations to the home. A lot of times someone may need a commode at night so that they reduce the risk of fall by walking to the bathroom in a dark hallway. Again, the grab bars are perfect. Is that if someone wants to maintain their independence and take a shower, and a grab bar would give them and us the confidence that they're going to be supported, that's something that we certainly would encourage and we would coordinate with.
Yeah, that's just great. Those are all the little things that really make the difference between somebody staying at home safely or having to look at other long-term care housing options, which, keeping a person in the community that they've helped to build over the past, 50 or 60 years is certainly what we're all looking to do.
That's true.
Now, we're kind of wrapping up our time. It's gone by so quickly, but I'm wondering if folks are watching the show today and want to know how to get more information, how do they contact you or contact your office? And, and how available are you in the community to speak to senior groups or to, meet with a senior individually? We
would certainly welcome any call, and we would be available. I would make myself personally available, but I have a team that could be reached by calling 518-472-5200, and that's our main number. And actually they could ask for Judy Randolph, who is actually our outreach coordinator. Judy can take any calls coming in, can answer those calls. We can set up appointments. We could actually set up community events for someone who would be interested. And actually we could provide more information on a really, again, a personal note. Well, that's great. It's great information, and I really appreciate you coming on and spending some time with me today so that we can educate not only the seniors in our town, but their family members who are really, helping them to navigate the system and make choices about long-term care and health insurance and what types of services that they need to remain independent in the community. And seniors, can always contact our office for more information, the Senior Resources Department at 459-5051. Our caseworkers are very skilled at knowing what the options are available to seniors and working with organizations such as yours. So I thank you very much, Meg, for coming on. It was a great show, and thank you for joining me today. I'll see you next time. I'm Cary from the Town of Colonie Senior Resources Department.